Ottawa has committed $2 billion in federal funding for provinces and territories to help their schools open safely. Alberta announced what it's going to do with its share of the money, more than $260 million. The province will allow schools to decide how to best spend most of that money. $250 million will be dispersed to school authorities based on per-student models, and it will be used for things like staffing, cleaning, and personal protective equipment. The remaining money will be used for schools seeing a large influx in enrollment due to increased demand for online learning programs. But one of the things that you hear and request for boards and provinces to do with that money is address the issue of air quality and ventilation. And that's what we're going to talk about for the next little while. My guest is Brian Fleck, who's a professor of engineering at the University of Alberta, and he is in Brule, Alberta. Professor Fleck, thank you for being our guest. I'm happy to meet you on the program today.
Thanks for having me today.
If you ask parents and teachers, as we are right now, all across the country, what their safety concerns are, for many, one of the things at the very top of the list is ventilation. Now, as the expert, when you hear that, do you share that?
Well, in general, I think there is a broad risk for the entire population of the kids going back to school and people in commercial spaces. But as an individual, I wouldn't be that nervous given the risk to people. You look at the numbers right now in Alberta, the number of people in ICU is in single digits right now. So as an individual, I wouldn't be worried, but yeah, I think it's really important for us to work on the risk for the entire society and keep this health problem under control. So ventilation is one factor.
Well, you raise an interesting issue because I think people need to understand when you talk about ventilation, it's the whole question of aerosolized transmission. And just before we carry on with the schools, I mean, if you bring up what the World Health Organization is saying about aerosolized transmission, we really don't have clear science on all of this. If we can bring up a statement, particularly in indoor locations that are crowded and inadequately ventilated, aerosol transmission cannot be ruled out. They urge further study, Professor Fleck, but they say it cannot be ruled out. So everybody now is suddenly looking at the state of play for air systems and air quality and ventilation in Canada's schools. And what is the state of things across the country?
Well, if you've got a great deal of infrastructure right across the country with a wide variety of different air handling systems and all of that infrastructure, it would be very difficult to very rapidly overhaul or renovate all of this infrastructure with the money that's being invested. So people who are managing this are going to have to take a risk management approach. That means they're going to have to look at the different systems and see which ones are the highest risk and focus on those systems and look for quick fixes in the short term. But then think about, systems that might be very high risk. When they do risk modeling, they do heat mapping, they look at green, yellow, red, and those areas that are in the red, they might want to be putting in-room ultraviolet or increased filtration systems. But we have to keep in mind what's realistic and what can be done in the short term. The problem gets worse. The problem gets worse as it gets colder and we have to do more ventilation and the air gets drier.
Okay, so you've raised a bunch of things that I'd like to ask about in a little bit more detail. So in the most at-risk things, there are technologies that may want to look at, but as you suggest, the scope is so broad, the cost would likely be prohibitive, and the time frame we're looking at is very short. So you mentioned quick fixes. What can schools and school boards and provinces look at right now as a quick fix?
Well, maybe I shouldn't have said quick fix because it sounds really haphazard. I think what's better is to think about a very systematic approach to implementation of safety. And this is something we've seen in industries like commercial airlines or, areas of industry that have really reduced the safety risks by going through systematic implementation. That means using checklists and having people write down when changes in filters and things like this were made, and really bringing in a culture of safety to the air quality for all of these systems. So that would be the first thing you would want to do, because it doesn't require technology. It's more about management. And so that's something that would be brought in right away and hopefully can be implemented before we get into the cold. We've got the flu season coming, which overlaps when we're using the most ventilation air, and the air gets drier, which is also worst. So, by the time we get to November, December, we're going to be in the high risk time. And so they're going to want to bring in policies and procedures that make sure everyone is doing what they should, and it's all traceable so that we know where our risks are. Quick fixes in technology will be really for the really bad systems where they could put in UV or in-room ventilation systems, but those we can't afford to do that to all the infrastructure in this.
So spending the time right now assessing the situation and can't afford to completely upgrade everything, we've put together just some facts and figures to give a bit of a national snapshot. These are issues and questions and analyses that we really have neglected, have we not, over many years? For example, let's look at some of these things together. Ontario has nearly 5,000 buildings. The average age is just under 40 years, but some go back to the 1800s, Professor Fleck. Manitoba, its average air handling unit is 44 years old. They're intended to last 30, and they have a huge budget in arrears for maintenance to building systems, $260 million. More than half of that is HVAC issues. If you look at Newfoundland and Quebec, aging schools, not even mechanically ventilated. So the scope of things facing provinces, and that's just some of the factual material we've gathered, I mean, it's overwhelming, and it hasn't really been a priority, has it?
That's exactly it. We've known that indoor air quality, not just for virus transmission, for reducing absenteeism, reducing pulmonary illnesses, allergies, just the level of health and happiness of people in workplaces are important factors, but they have been neglected, and we call that the infrastructure deficit. By saving money and elsewhere, this invisible problem has gotten worse and worse over time. And now is suddenly people are looking to try to fix this, and this doesn't happen overnight. It requires quite a bit of time and, of course, financial resources. So governments will need to focus on the areas where the risk is highest today. But, to finish off here, I think we need to think about air quality in general without panicking, because again, the number of cases I know in the province where I live in Alberta is in single digits, people in ICU right now. So as a country, we've done a pretty good job of getting this under control. We need to maintain that vigilance and culture of safety and have people go out there and work on improving air quality for all the reasons, not just for COVID-19, all the reasons that it improves things.
Let me just ask one question before I go, because the dog's gotten up and is moving out of the shot, and that must mean we're getting to the end of our conversation. But what I'm wondering is, as we talk about that, you mentioned winter. I mean, as a short-term thing, they're talking about keeping the windows open and having as much outdoor exposure as they can right now, as they assess things and bring in perhaps technology in the worst situations. But what about in the interim and maybe even long-term? Where do masks fit in from your perspective? Where does physical distancing fit in as another mitigation measure?
Great question. Sorry, I should have mentioned that. And one of the things we know in removing pollution from any source, the most important thing is to get it at the source. It takes much less energy to remove pollution from the source. And so we want to think about where the greatest sources of aerosols are, and they come from people's mouths. Masks are very low cost. very easy to implement, and we can keep track of who's wearing them just visually. So of course they should be worn. We should be thinking about increasing ventilation maybe in bathrooms, because we're seeing that what happens when people use toilets, that there's increased aerosols. And there are other places other than schools where there's a lot of aerosols generated in dentist's office and in medical facilities, and those also we need to get to the source to reduce these risks, as opposed to trying to, they say boil the ocean. We want to get to where the aerosols are being generated, and masks do a great job.
Okay, thank you, Professor Fleck. Really appreciate your expertise on an issue that we are finally paying very close attention to. He's in Brule, Alberta this morning.